Spleen Qi deficiency. This pattern is due to spleen Qi deficiency and failure of transportation and transformation. It is also called spleen failing to transform and transport. Key symptoms: abdominal distension, poor appetite, loose stools, along with a Qi deficiency pattern. Clinical manifestations: abdominal distension or bloating, especially after meals, poor appetite, lack of ability to taste foods, loose stool, lassitude of the body and limbs, fatigue, lack of strength, shortage of qi, laziness in speaking, emaciation, sallow complexion or obesity, edema, pale tongue with a white coating, moderate and weak pulse. Analysis: this pattern is usually caused by irregular diet, overstrain, fatigue damage, overthinking, and overworrying, impairing the spleen, hereditary weakness, deficiency with old age, or improper nursing care in severe diseases. Analysis of a spleen Qi deficiency pattern. Failure to transport and transform will cause failure to transport food and water, causing a hindrance. So this will lead to abdominal distension and poor appetite. There will also be aggravation of spleen Qi deficiency after meals, and this leads to abdominal distension after meals. Weakness in digestion, failure to separate usable and unusable part of the food, then going down into the intestines will lead to loose stools. Failure of transportation causes formation and retention of water dampness. So there will be edema and obesity. Hypoactivity due to Qi deficiency will cause failure to fill up and nourish the body and flesh, leading to lassitude of the body and limbs and a thin body. Hypoactivity due to Qi deficiency will cause failure to raise the clear Qi upward to nourish the face, so there will be sallow complexion. There will also be deficiency of Zong Qi, so shortage of Qi and laziness in speaking. Etiology of spleen Qi deficiency, to summarize, is excessive consumption of cold and raw foods, which hinder the spleen, irregular eating and eating too much, excessive mental activity, anxiety, prolonged exposure to damp, chronic illness. Underlying or accompanying pathology: stomach Qi deficiency, spleen Yang deficiency, lung Qi deficiency. Signs and symptoms: poor appetite, abdominal distension after eating, tiredness, pale or yellow complexion, pale or dark lips, dizziness, low voice, shortness of breath, weakness of the limbs, loose stool, slight depression, tendency to gain weight. Pulse is empty, tongue pale, thick coating. Treatment principles: supplement the spleen, warm the lower burner. Acupuncture treatment: Ren 12 to fortify stomach and spleen, stomach 36 to supplement spleen qi. Spleen 3 is the yuan source point of the spleen. Spleen 6 will also supplement the spleen qi. Bladder 20 will supplement the spleen qi in chronic cases. Bladder 21 supplements stomach and spleen qi. Ren 4 supplements qi. Ren 6 will warm the lower burner. We needle with supplementation and moxa. Relevant advice: dietary changes are alpha and omega in the treatment of spleen Qi deficiency. This encompasses both what is eaten and how it is eaten. A person who is spleen Qi deficient should eat as much prepared and warm food as possible. They should avoid raw vegetables, salads, food that is very coarse, cold drinks, ice cream, and food that generates dampness, such as sweets, dried fruit, artificial sweeteners, honey, stevia, dairy products, bananas, avocados, and so on. They should avoid eating too quickly, too much at a time, and whilst reading, watching television, or working. They should chew their food well and avoid drinking too much at meal times. They will benefit from eating soups, mashed vegetables, purees, porridge in the morning, stews, steamed or boiled vegetables and baked vegetables. That is food that is easily digestible and preferably warm. The weaker their spleen qi is, the more digestible their food should be, as long as it does not create dampness. Drinking a small cup of ginger tea at mealtimes will help to fortify spleen yang, thereby assisting the spleen in its transformation of the food. The use of herbs in the diet, especially aromatic spices like black pepper, ginger, cardamom, garlic, cumin, caraway, and nutmeg, will also assist in circulating qi, dispersing food stagnation, and transforming dampness, thereby alleviating the burden on the spleen. Foods that are particularly beneficial are rice, oats, barley, most vegetables, especially root vegetables, squash, sweet potatoes, and those that are yellow or orange in color, red lentils, tofu, chickpeas, and chicken. It is important that the person does not regularly sit still for extended periods of time and that they do not sit in a slump posture. Walking or stretching after meals is recommended. Physical exercise in general will be beneficial as long as the person does not overexert themselves. Stroking downwards with the fingers from REN 16 to REN 8 will help stomach chi to descend. Meditation is interesting in the context of spleen chi deficiency. Often we recommend yin activities like meditation rather than physical activity when there are chi deficiency conditions. However, meditation where you sit still for long periods of time can burden the spleen, and excessive mental focus can consume spleen chi. This does not, though, mean that meditation in itself is negative when there is spleen chi deficiency. It just requires taking certain factors into consideration. If you're able to meditate with an empty mind, then it will be beneficial. Meditation is also an excellent tool to reduce the tyranny of worry, speculation, and repetitive thoughts. Walking meditation will generally be a better option for a person who is spleen qi deficient, as walking circulates qi in the middle jaw, while sitting still can cause qi to stagnate in the middle jaw. Thank you for your attention.